In recent years, the conversation about weight loss has changed dramatically. It's no longer just about counting calories or following the latest trendy diet. People are starting to ask deeper questions about their health and what really works for long-term results. More people are looking for real solutions that work, not just fad diets or short-term fixes. They want something sustainable, something that fits into their busy lives and actually delivers results they can see and feel. As obesity rates continue to rise across the globe, the need for new, effective treatments grows stronger. Doctors and researchers are searching for answers, and patients are eager for options that go beyond what's been available in the past. People are hopeful for something that can help them take control of their health. For many, it's about more than just losing weight. It's about gaining confidence, energy, and a better quality of life. New weight loss medicines are making headlines and sparking conversations everywhere, from doctors' offices to online forums and social media. They offer hope to people who have tried many things and still struggle. For those who have faced disappointment after disappointment, these new medications represent a fresh start and a renewed sense of possibility. These medicines promise more than willpower. They use science to help people lose weight safely. By targeting the body's natural processes, they can make it easier to stick to healthy habits and see real progress. It's not just about looks. For many, weight loss is about feeling better, moving more easily, and reducing the risk of serious health issues. Weight loss can lower the risk of diabetes, heart disease, and other health problems that can impact daily life. Even a small amount of weight loss can make a big difference in overall health and well-being. Tirzepatide is one of the newest medicines that has caught attention. It's being talked about by experts and patients alike because of its promising results in clinical trials. Doctors and patients alike are curious about it. They want to know how it works, who it's for, and what kind of results they can expect. The buzz is strong because tirzepatide works in different ways than older drugs. It targets multiple pathways in the body, which may help people lose more weight and keep it off longer. Some people even call it a game changer. For those who have struggled for years, it represents a new chapter and a chance to finally reach their goals. People want to know, is tirzepatide right for me? What should I expect? How does it compare to other options? These questions matter, and getting the right answers is important for making informed choices. Knowing the facts is the first step toward making a smart, safe decision. By learning more about these new medicines, people can take control of their health journey and find the support they need to succeed. Tirzepatide is a prescription medicine that's become increasingly popular for weight loss in adults. It's not available over the counter, so you need a doctor's prescription to get it. Many people are hearing about tirzepatide for the first time, and it's important to understand what it is and how it works. Tirzepatide comes as an injection, and most people take it just once a week. The injection is usually given in the stomach, thigh, or upper arm, and many people learn to give it to themselves at home after some training from their healthcare provider. Originally, doctors prescribed tirzepatide to help people manage type 2 diabetes. But during studies, researchers noticed that patients were also losing a significant amount of weight. This discovery led to its use as a weight loss medication, especially for adults who struggle to lose weight with diet and exercise alone. Tirzepatide belongs to a newer group of drugs called GLP-1 and GIP receptor agonists. These medications are different from older weight loss drugs because they target more than one pathway in the body. Specifically, tirzepatide acts like two natural hormones, GLP-1 and GIP, that help control both hunger and blood sugar. These hormones send signals to your brain and pancreas, helping you feel less hungry and keeping your blood sugar steady. By mimicking these hormones, tirzepatide helps people feel full more quickly during meals and keeps that feeling of fullness lasting longer. This can make it easier to eat less and avoid unhealthy snacking between meals. In addition to helping with appetite, tirzepatide also helps the body use insulin more effectively. This is especially important for people with diabetes or those at risk for high blood sugar. What sets tirzepatide apart from other medicines is its dual action. Most older weight loss drugs only target one hormone, but tirzepatide targets two, making it more effective for both lowering blood sugar and supporting weight loss. Because of this, many patients see better results in both their blood sugar levels and their weight, which is why tirzepatide is generating so much excitement in the medical community. That's why so many people, especially women over 40, are interested in learning more about tirzepatide and whether it might be right for them. However, it's important to remember that tirzepatide is not a magic shot or a quick fix. It's just one part of a bigger plan to improve your health. To get the best results, people taking Tirzepatide should also focus on healthy eating, regular exercise, and making positive lifestyle changes. The medication works best when combined with these healthy habits. So, even with Tirzepatide, making good choices every day, like eating nutritious foods, staying active, and tracking your progress, is still essential for long-term success. Tirzepatide is not for everyone. While it has shown promising results for many, it's important to understand who can benefit from it and who should avoid it for their own safety. Doctors typically prescribe Tirzepatide for adults who are overweight or have obesity, especially when other weight loss methods haven't worked well enough. This usually means having a body mass index or BMI of 30 or higher. Sometimes people with a BMI of 27 or above may also qualify if they have weight-related health problems, such as high blood pressure, type 2 diabetes, or sleep apnea. These conditions can make losing weight even more important for overall health. However, Tirzepatide is not safe for everyone. People with certain medical conditions should avoid using it, as it could make their health worse. For example, anyone with a personal or family history of certain types of thyroid cancer, such as medullary thyroid carcinoma, or those with severe digestive problems like gastroparesis, should not use Tirzepatide. These risks are serious and must be discussed with your healthcare provider. Pregnant women, breastfeeding mothers, and children are also not good candidates for Tirzepatide. The effects of this medication on unborn babies, infants, and young people are not fully understood, so it's best to avoid it in these groups. Before starting any new medicine, especially one like Tirzepatide, it's essential to have an open conversation with your doctor. They can help you weigh the benefits and risks based on your unique health situation. Some people may hope Tirzepatide can help them lose a small amount of weight just for appearance or cosmetic reasons. However, this medication is not intended for those who simply want to slim down for looks alone. It is not meant for cosmetic weight loss, and using it for this purpose can be unsafe and is not recommended by medical professionals. Tirzepatide is specifically designed for people who need to lose weight to improve their health, manage serious medical conditions, or reduce their risk of future health problems. Using Tirzepatide without a real medical need can be risky. Side effects and complications can occur, especially if you don't have the right medical supervision. Your doctor will carefully decide if Tirzepatide is right for you by reviewing your health history, current medications, and your personal health goals. They will also consider any other treatments you are using and make sure Tirzepatide won't interact with them or cause harm. Never buy Tirzepatide online or use someone else's prescription. Only use medications prescribed directly to you by your healthcare provider. Your safety should always come first. The biggest benefit of Tirzepatide is weight loss. In studies, many people lost 15% or more of their body weight over a year. Some even lost up to 20%. These results are much better than what older medicines can offer. Tirzepatide can also help with blood sugar control, especially in people with type 2 diabetes. This means it may lower the risk of diabetes-related problems, such as eye or kidney disease. Some people also see better cholesterol levels and lower blood pressure. Losing weight with Tirzepatide can improve overall well-being. People often report having more energy, sleeping better, and feeling more confident. These changes can make a big difference in daily life. Remember, not everyone will lose the same amount of weight. Results depend on many things, including diet, exercise, and genetics. Tirzepatide works best when combined with healthy habits. Like all medicines, Tirzepatide can cause side effects. Most are mild and get better with time. The most common side effects are stomach problems. These include nausea, vomiting, diarrhea, and constipation. Some people also feel tired or have a decreased appetite. A few people may have more serious side effects. Rarely, Tirzepatide can cause inflammation of the pancreas, called pancreatitis. Symptoms of this are severe belly pain that will not go away. Allergic reactions are very rare but can happen. Call your doctor if you have trouble breathing, swelling, or a rash. Some people notice weight loss is faster at first and then slows down. This is normal. Your body needs time to adjust. If you have bad side effects, your doctor may lower your dose or stop the medicine. If you feel worried about side effects, talk to your healthcare provider. They can help you manage them and answer your questions. Do not stop Tirzepatide suddenly without medical advice. Before starting Tirzepatide, a full health check is important. Your doctor will ask about your medical history and any medicines you take. They may do blood tests to check your liver, kidneys, and blood sugar. This helps find any problems before they start. Tell your doctor if you have had pancreatitis, gallbladder disease, or thyroid cancer. Also mention any allergies or if you are planning to get pregnant. It is important to share everything, even things that seem small. Make sure you understand how to use Tirzepatide. Your doctor or nurse will show you how to give yourself the shot. Ask questions if you are not sure. Write down the instructions or take notes. Have a plan for tracking your progress. Weigh yourself regularly and write down how you feel. This helps your doctor see how the medicine is working. Stay in touch with your healthcare team throughout your treatment. Tirzepatide works best with healthy habits. Eating a balanced diet is key. Focus on lean proteins, whole grains, vegetables, and fruits. Try to avoid processed foods and sugary drinks. Small, regular meals can help keep your stomach settled. Exercise is also important. Aim for at least 150 minutes of moderate activity, like brisk walking, each week. Strength training a few times a week can help you keep muscle while losing fat. Start slow and increase your activity as you feel stronger. Staying hydrated matters too. Drink plenty of water throughout the day. This can help reduce side effects like constipation and help your body work better. Try to limit high-calorie drinks like soda and alcohol. Good habits make Tirzepatide more effective. They also help you feel better and build a routine you can stick with even after stopping the medicine. Many people worry about regaining weight after stopping Tirzepatide. The truth is, some weight gain can happen if old habits return. The medicine helps, but it is not a permanent fix by itself. That is why building healthy habits is so important. After stopping Tirzepatide, keep your focus on good eating, exercise, and self-care. Make a plan with your doctor for what comes next. They may suggest regular check-ins, support groups, or even other medicines if needed. Your body may take time to adjust. Be patient with yourself. If you notice your appetite returning or weight creeping up, do not panic. Small changes, like tracking meals or adding a walk, can help you stay on track. Remember, the goal is long-term health, not quick fixes. Tirzepatide gives you a boost, but your daily choices keep you moving forward. It is easy to hope for a magic solution. Tirzepatide is powerful, but it is not a miracle. Think of it as a tool, a helping hand on your journey. The real work still comes from you. Using Tirzepatide without making lifestyle changes often leads to disappointment. The best results come when you combine medicine with healthy food, activity, and support from family and friends. Celebrate every step, no matter how small. Setbacks can happen. If you slip up, do not give up. Talk to your doctor, adjust your plan, and keep going. Long-term success is about progress, not perfection. Tirzepatide is just one part of your health journey. Use it wisely, and focus on building habits that last. Choosing to use Tirzepatide is a big decision. Always get advice from a trusted doctor or healthcare professional. Ask questions, read about the medicine, and know what to expect. The more you know, the better choices you can make. Remember, no medicine replaces healthy habits. Think about your goals for the long term. Losing weight slowly and steadily is safer and easier to keep off. Stay patient, be kind to yourself, and celebrate your progress. Surround yourself with support. Friends, family, or a support group can help you stay motivated. Share your journey and learn from others. You are not alone. In the end, Tirzepatide can help you get started, but lasting health comes from your choices. Stay informed, stay positive, and take care of yourself every day.